So I realized the green economy speakers are already speaking about health. So they started talking about the virus and the impact of the virus. So maybe we all should try and talk about the green economy. And actually, maybe while we get switched, Diana, cement and green. So because, we probably can take this opportunity to talk about, Bamburi cement and, and it's always big challenge for you guys to be on the green side of things. So how are you
Yes.
handling that?
So one of the innovative things that we've been able to do over the years has been to be able to rehabilitate used quarries. And one of the things that we are so proud about is what we call the Lungs of Mombasa. The Lungs of Mombasa is a Hala Park that was rehabilitated many years ago by Dr. Rene Hala. And that's how the park was named after him. So when you go in there, you will never know that that used to be a quarry. We have animals. We have a whole pavilion where we keep butterflies, and we've also been able to do a facility, what you're calling the forest trail. So it's sort of like a walk through nature. So you can go cycle, you can go jog, and it's one of our commitments that whenever we have finished mining or excavating, that we can go back and rehabilitate this into a productive land that people can be able to draw out of it. So yes, so those are one of the things that we have been able to do at Bamburi Cement.
That's interesting, and obviously health, and from a BI perspective, Ilka, do you see any of these impact on climate change, and how is BI as an organization looking at climate change, and what is the impact? Is there even an impact for pharma companies?
Yeah, I think like many other companies, we're also having set up initiatives. I mean, one is called Be Green, yeah, which covers pledges the company and the corporation globally what's to follow, yeah, to improve the climate situation, and that is with respect to are we still on?
Yes.
We are back on our session. Elika?
No, not yet. I'm still checking with the technician.
I think we are on our session, so maybe we can formally get started.
We have now.
Yes. So really sorry for the little technology challenge. They always say technology, fails in the right moment, and it has been true for us this morning. Thank you for bearing with us, and this session on global health citizens, and it's a town hall, and it's structured in the way of certain questions that what we can talk, and all of you who are listening to us are more than welcome to post your questions. And we have some amazing, panelists lined up today. One, we have a social entrepreneur who works on the ground. We have a person who works with a cement company from the health perspective. And we also have our partners, Boehringer Ingelheim, and the Making More Health partners, and we'll talk a little bit about it. So before we get started, I just want to kind of frame it by 1 minute. We have less time today. So the 1 minute framing is that we are living in a new reality. That's all true. We've all seen the pandemic. We have discussed it enough. 6 months of lockdown, new lockdowns coming up, the number of deaths. We have seen all of that, happening in the world. And what we thought we will do in the next 50 minutes is that we can take the framing of the pandemic, the new reality, the new sort of perspective we're all used to now, but probably we'll spend much lesser time in talking about the pandemic and COVID, but rather see the opportunities which is throwing at us, and how can we see things differently so that we can do differently. So all your questions, we really welcome you to kind of frame it from that perspective. That would be fantastic. So Before we start, I really want to welcome our three panelists today. We have Neka Mobison, who the founder of MDoc and an Ashoka Fellow. We have Diana Ruchugo from Bamburi Cement and Ilka Wike from BI. So thank you very much for joining us. And we also have our my co-moderator or person who's going to help me in the background, Yeleka. So thank you, Yeleka, for joining us as well. So all your questions, please feel free to put them on Swapcard. Now, before we get started, I just wanted to kind of throw out a reflection by saying what has been the biggest aha moment in the last 6 months. So for me, the biggest aha moment has been that we work with nutrition in underserved communities in India. And somewhere in a small village in the northeast of India, we received a text message from a young person who is studying in a school and on nutrition using WhatsApp. Now, 6 months ago, we would not have imagined that somebody in the most rural part of India would use WhatsApp to send us a message to ask a question. Today, that's been my aha moment and said, my God, this is so different from the past. And now we're talking about using an AI-based automatic response system for some of the questions children are able to ask from anywhere in the world using WhatsApp. So for me, that's been an aha moment. So I'm going to ask Diana, what's been your biggest aha moment in the last 6 months?
Wow, thank you so much, Vishnu. So for the last 6 months, when I look at COVID and its evolution, especially when I look at it from the context of the African continent, one of the things is as a continent, we made a commitment known as Abuja Declaration many years ago, 20 years ago, where that government will be putting aside 15% of their resources into healthcare funding. Well, that has never been achieved, actually only 2 countries so far. So when I look at this pandemic and its opportunities, and my aha moment is that now, even in the remotest area, I think across the continent, you can find at least one ICU bed, which was not our reality a few months ago. So for that, I think it's one of those things to realize that it can actually happen in this day and time.
Absolutely, well said. And Neka, what was your aha moment? I'm sure you have many.
Thank you, Vishnu. I was literally just about to say that I've had many. But I think linked to what you and Diana have highlighted, it's really around healthcare, that healthcare is laden with mindsets, biases, rules, barriers that literally can be broken down overnight, contrary to historical positions. COVID did that. COVID literally changed regulation. COVID, as a social entrepreneur trying to work in the digital healthcare world for the last 3.5, 4 years, I've been met with so much bias around whether digital health could really work in Africa, despite our astronomical mobile phone penetration rates and the advances we've seen in fintech. And literally overnight, the receptivity, not just in Africa, but across the globe, and the recognition that digital had a role to play, and not just for now, but for our foreseeable future in terms of access to quality, affordable, convenient, reliable healthcare. It happened overnight, and I'm thankful to COVID for that, despite all the tragedies that we've seen as a result of COVID.
Thank you so much, Neka. Ilka.
My aha moment really was with respect to a small but very much underserved and discriminated population I learned about in Africa, the albinism population. And I was really, really inspired. I mean, how fast and much awareness can be created for these people and population, and how the ecosystem can be leveraged in terms of platforms and community activation to help these populations. I was wondering whether this would be a very nice blueprint to roll out to other healthcare problems in communities or on a community level.
Thank you so much, Ilka. So let's just dive straight into our discussion. So, I think I also see all of us as really being fortunate in this time of history, that, we are seeing a moment in our lives that we can clearly say before and after, right? So, when we all get old and we're talking to our great grandchildren, hopefully, we'll probably say that this was before and this was after. And that, I think, we are extremely fortunate to live through this experience of what was the past and what is the future. And this transition from the past to the future, in my opinion, has got a very profound impact in our everyday work. The way we see our reality, the way our work is going to happen in the future is going to be very different from what it used to be in the past, both for good and for bad, right? So it's got a combination of both. So I think this 6 months, at least in the last 6 months, has changed and left a forever influence on how we're going to do our work in the future. So we are not yet there to kind of see what we are doing. But right now we have a moment to reflect. What is that we are seeing differently, right? So what are you seeing differently in your own work, in your communities, in your companies, in your, interaction with people? From your perspective and wearing this health cap, what are you seeing differently from before and leading us to the after, right? So I'm going to start with Neka. So please, you have this amazing insight from the communities you work with. So what are you seeing differently?
Sure. Thank you so much, Vishnu. If I could say what we're seeing differently, it really, I wish I could take snapshots in time over the last several months, because we're human, right? At the end of the day, and we also have short-term memories a lot. So if you look, I almost see it almost as a sinusoidal wave in terms of what's different. So at the beginning of the pandemic, right in terms of when it hit Nigeria, which is where we largely serve, we saw really increased anxiety and fear from the people that we serve. And we serve, on average, people who make less than $100 a month from a household income perspective. The same populations that folks would say, look, they don't have access to good quality health, they're not going to leverage digital, etc. That, without question, was not the case. These are folks who recognize when facilities shut down, when they weren't being able to get the services that they required, that they being able to rely on digital to access support on the other end literally was the difference between life and death for them. And so that receptivity, that openness, that willingness, and that desire to invest in trust that could be achieved by leveraging the mobile phone, that happened, right? And that's different. So now in terms of the people that we serve, it's grown literally over 4 or 5 times in the last 6 months, and this is the low income population willing to leverage digital for care. At the same time, on the supply side, it's really exciting. We've seen regulators, governments, providers very excited about digital. The second piece that we've seen is that people are open to data. We always would talk about big data and analytics and but when it really came down to it, we weren't using data. The surveillance systems that we've been able to leverage as a result of technology across the world. How many of us literally go to Twitter or go on websites trying to see what the latest COVID numbers are, right? So we're talking now in terms that we didn't use before. We're using data in a way that I hope translates into how we live our daily lives and how we integrate in terms of how we work, because data really is the future. And then the last piece that I think that is different is that people, without question, not only they recognize prevention, prevention is power. Prevention, hands down, is power. And I don't think that we invested enough on the prevention side before, and having people understand that is wonderful. My fourth and final piece truly is that mental matters. That, where there's such a people are open now to talk about our mental health. Wherever you are in the world, we're all open talking about kind of the struggles that we're having individually or collectively. And I think there's a beauty in that, because hopefully that means that we can address the fact that there are 1 billion people living with mental health needs that haven't been addressed to date. So again, opportunities that COVID has presented, and it's a different world today.
Thank you, Neka. And this mental health issue, and I really like the way you say it, mental matters. because all of us are isolated now. Isolation was only for a small sect of people before. Now all of us are facing it. So it's truly, I think when it becomes really to the forefront. So Diana, you also work in, similar environments and also in Nigeria, so in Kenya. So how are you seeing, what is that you think, what are the things you see differently now?
Okay, so thank you very much. I think I will echo much of what also Neka has talked about. For a very long time, we've had a role within the public health system that we call an epidemiologist. But for a very long time, I think we have taken for granted the work that they do in terms of disease surveillance and to be able to harness the power of their information to predict, even the different patterns of disease. So I think now more than ever, we have come to appreciate the role that these people play. The other thing that I have seen, which has been fundamental, especially in our country, one of the things that was very clear was pandemics are not covered by insurance companies. And every one of them ran away and said, absolutely not. I remember struggling with them to have a conversation. And they told me, the problem is that you are on the other side. You're in the side of the companies and not on our side. And I kept telling them, but when we look at this disease and look at how it's presenting itself, especially in the continent, it's very clear we're talking about 10% of the population who get COVID will need then to be supported within facilities. Why would we shun away from these people? Why are we running away? And to start that conversation of looking at it and saying, guys, this pandemic is going nowhere. So we need to develop some innovations around how do we then support people to get access to healthcare using the platform of insurance. And so that has been a very interesting discussion. And luckily for us, we have been able to engage and be able to move it to a level whereby then we are able to get a cover for people for COVID. The other thing, like Neka has said, is the issue about data. We've talked about data. And it was also my challenge to the insurance that there's a lot of information sitting everywhere, but we're not able to use AI to predict and say, out of all these people we have sitting here, what is the probability that X number of people will get severe COVID, and how do we do that? So we've been sitting on data, and the saddest thing is that most of this data is manual. There are always sheets of paper moving from one desk to another. So we don't even have an opportunity to move this information into an electronic system where we harvest a lot. And I think there's been pockets of good excellence. For example, what we've seen in the US, like the issue of loss of sense of smell was picked up by AI. If it was up to us to pick it, we'll never have picked it as a symptom. So I think that's important. And also, as Neka has said, the issue of mental health has come out. I think COVID has brought it to the surface, and nobody can ignore the aspect of mental health. It is here with us. It's time we talk about it. It's time we all unveiled our masks and just say it as it is and get people to be supported by it. So that will be my submission on this particular question.
Thank you, Diana. Ilka, what are you seeing? And as a company, right? Because I'm sure you are in the core of many things happening.
Yeah. As a company, I'm very inspired to see basically a change in perception, because we are left totally unprepared by this pandemic as pharmaceutical companies. And I'm very intrigued about models which are coming up now and are explored strategies called pandemic preparedness. And for pharmaceutical industry, I find this very, very interesting to, first of all, join forces. You see joint ventures between major players on these strategies and trying to find therapeutics, but also vaccination approaches. And in terms of pandemic preparedness, look into what can be done to prevent or be more prepared for the next potential pandemic. It's an interesting way of thinking for pharma to put a lot of efforts in a product of which you hope which will never come into play.
Thank you so much, Ilka. I really want us to kind of indulge in this one point, I think, which Neka brought up. Prevention is power, right? So, I really like the way it was framed, that prevention is power, and the communities now are realizing that it's much better and we'll save a ton of money if we work on prevention, right? And I'm going to start with you, Ilka. What, as a company, right? Because obviously a pharma company is about treatments and, kind of taking care once you fall sick. And obviously, making more health is all about, identifying prevention as well. How do you see prevention, right? Meaning, and how do you see that prevention is a power, and what is the role of a company like yours and making more health as a unit to kind of work on prevention?
That's a very good question. I mean, prevention, I guess, in making more health and the communities would mean to think much more on a holistic basis. Yeah, leverage ecosystems and think out of the box, maybe. Yeah, to combine all issues to access to potential healthcare treatments and create, let's say, a basis on which a prevention model could work. And this is connected to not only therapeutics, as I understand it, yeah, but also to infrastructure, but also to education and other layers, yeah, and pillars.
Thank you. And Diana, we touched upon this during the pre-panel discussion, right? Meaning, prevention and cement companies probably, it's a challenge. And you are in that hot seat as, the person who takes care of health in a cement
Yes.
company. So how do you reflect on prevention, right? Meaning, what can you do as a company and as an individual who's leading health in a cement company? How do you see prevention, and what steps do you take?
Well, that's a good question. So one of the key elements in prevention is to get people first aware, because one of the biggest thing, and I think what we are seeing also with the pandemic, the issue of misinformation and disinformation that is out there a lot. So to be able to get people to understand what to do, first you need to empower them by giving them a lot of awareness, information, empowering them through information. Then the other thing that I have found very useful in helping people in the prevention piece is to be able to have an individual who's walked the journey and come back to give their testimony about the journey. That is very, very, very powerful. Why? Because people relate to them. It stops being a concept, because when you take people through, especially like now we're doing Zoom, we do most of these awareness sessions in Zoom. So people can say, oh, she knows it because that's what she does. She's a health professional, that's her cake. But when you hear from someone saying that I have walked this journey of, let's say, whatever it is, whether it's diabetes, hypertension, mental health, and they come out and talk about their journey, and it stops being faceless to them. So I've seen that work a lot. It is very powerful. The other thing that I have seen that was been interesting is on prevention, especially on this basic thing, hand washing. It's been able to reduce diarrheal diseases in children significantly. It's a small thing, but after the people started embracing it, including adults, when I look at the data, I have had zero diarrhea from the month of March, other than 2 or 3 related to COVID, which has been very interesting. So I think the best way to support people in prevention is give them awareness. And on top of that, let them get an individual, a key opinion person that they can relate to and apply that to themselves. And do not leave them alone for too long. Come back to them again and create the awareness. Let them ask questions, be transparent. I think that has worked a lot in the prevention piece.
Thank you, Diana. Hand washing is so interesting because, health professionals for decades have been saying, wash your hands, wash your hands.
Yes.
And now, thanks to the pandemic, at least hand washing is becoming accepted and it's kind of, practiced. And an Apple Watch now counts down when you start washing your hands. I think, it's becoming into highlight. Now, Neka, is all of these good enough, right? Meaning in terms of prevention as one lens, right? What else should we be doing? And I'm just going to kind of ask you also from this perspective of saying, what else should we be doing? What are the other dimensions of doing differently, right? Meaning, what else should we be doing differently here? And from what you're seeing?
Thank you. Yeah, so it's interesting because when we look at prevention as a whole, right, we first start with awareness and education, and there's that piece, and that, as Diana has highlighted, and there's also trust, right? It's you can have all the education in the world, but if you don't trust the people or the system, as you can see in many other parts of the world today, there's a lack of trust that is influencing behavior, and so it's really about, I think, about system architecture, right? How do we look at our system? How do we kind of change the architecture to nudge people to do what they need to do, right? So one element, hands down, is this awareness piece and then the trust piece. But how do we increase their ability? I mean, if you look across the world, there are many people, we're talking about hand washing, but there are many people who don't have access to water. And to even imagine getting hand sanitizer that has 70% alcohol is not realistic for them, right? I mean, that would be a luxury. So how do we create a system? How do we essentially facilitate cross collaboration across industry, right? To create that system and essentially an ecosystem that actually it creates this enabling environment for change. I mean, I think that's COVID, I've had a lot of people say COVID has facilitated accelerated collaboration across industry in ways that people never even imagined was possible. And I think that's true. And I still think there's opportunity. There's greater opportunity. We need to have more collaboration because all of us are, suffering from COVID fatigue, even those of us who are inside. So it's not, when I talked earlier about kind of the sinusoidal wave, in the beginning, everyone wanted to make a change. Everyone wanted to, contribute to changing this system so that we would have a different tomorrow. And I think some people are tired. And so how do we get people in the right virtual room, in the right space? How do we create accountability and governance systems so that when people commit to actually changing the environment, to lowering data costs so people have access to digital, to really investing in our facilities, our community care programs, our hospitals, in ways that actually are going to create lasting, sustainable change. For people who say they're going to invest in our healthcare workers, I'm sorry, but they've been abandoned for too long, who understand that we can't continue to do that, who are willing to invest in them, that they actually make those investments in terms of education, in terms of training, in terms of figuring out ways so our countries can actually retain the healthcare workers that we've been. So it's all these different elements of the system. How do we work collectively? And how do we create these structures that ensure that this is sustained, that the momentum that this pandemic has generated for us is sustained? Those are some of the questions that we are worried about, that we have. Everyone talks about digital. It's exciting. It's wonderful. But I'll be honest with you. I've started seeing, some fatigue around even digital, right? And I worry that if we don't have that same excitement that we had in the beginning, that we're going to leave those who have historically been left behind. The digital divide is going to be even greater. And those who have suffered from the inequities of this pandemic, the magnitude of that is only going to increase. So the opportunity for us is, to convene, to work together, to grab this momentum and continue to build kind of sustainable structures and processes and systems that will drive a completely different future for all of us.
Thank you, Neka. We'll come back to collaboration in a minute, but I really want to get some thoughts from Ilka. Ilka, what from a pharma company perspective, and wearing also your making more health hat, what should we be doing differently, right? Meaning, if we know what's the reality is going to be different, what should we be doing differently?
Yeah, I think it's exactly what has been said. Yeah, use and leverage actually the ecosystems. Yeah, and combine efforts. Yeah, combine efforts in terms of working together between, for example, this one very nice example out of the Making More Health initiative, combining insurance companies with healthcare providers and mobile providers, yeah, to make help making healthcare accessible. Yeah, and I think we should see many more of these models. Yeah, not thinking in silos. Yeah, or pillars. Yeah, like how do we, I mean, develop any healthcare enabling approaches for certain regions, but really think beyond it. Yeah, what would it need on the educational side? I mean, how can I invest in the educational side? How can I make a connection between maybe entrepreneurs or the enterprises working together on most prominent healthcare questions to really, I mean, bring them to the population and the people needed. Because if it basically also has been said, if people are so much concerned about support their daily life, I mean, how would they be open for awareness on diabetes, which is not even, I mean, a problem for them right now. So I think it's multifactorial.
Thank you, Ilka. We'll also come back to the point of how do we get people together. Diana, what do you see from your work? What should you and us we be doing differently?
Well, that's a good question. One of the things I think that is important for us to see differently is how we package health. For a long time, health has been packaged as that place where everything is consumed and not produced. As long as we keep seeing health as that place, like a well, you just throw it in, never ending like an ocean, we will not be able to benefit from it. So one of the ways, of course, that we need to do differently is how we package health. The other thing that we need to do differently, and I think Neka had somehow alluded to it, is the neglect that we've had in our healthcare systems. For a very long time, we've let, that place that consumes, just let them be. So we sort of like turned our eyes around it, maybe because we don't see it as a lever, a real lever towards as an economic driver. So it has been neglected a lot. The other thing that I think we need to do differently is empower our people. I think that, of course, we know that we have an issue around poverty, but one of the ways of helping people, especially in poor areas, is to be able to give them the right information so that they make the right decisions. So as long as our people are disempowered, we will always have this vicious cycle where we go around in circles and never ending, and hoping that one day we'll be able to come out of that. So I see that as one of the things. The other thing that I see, especially for us, is how we consume data. We definitely need to move from paper-based information into an electronic system and be able now to start consuming it, interact with it, use data to make information as opposed to, theories. Because what happens is we pick a theory here, we pick a theory there and apply it into our context. But if we consume our own information, it will be very powerful then, because we will have better material to make our own solutions. So I think that is one of the things that we need to do differently. So there are actually 4.
Okay.
Yes.
Great. So if I may, I'm going to be a little provocative for the next few minutes. So please bear with me. This word collaboration probably drives all of us a little crazy once in a while, because every single meeting and every single conference we go to and we listen to others or we participate, people talk about, oh, we need to come together, we need to work together. That's the solution for everything, right? But this is an ongoing work, right? Meaning collaboration seems to be a theme of every sort of, co-creation meetings or workshops and stuff like that. Or kind of, a go-to solution is, oh, we need to collaborate, right? So I just want us to be provocative for a minute here by saying, if collaboration and all of this is given that it's absolutely critical, why are we in a different place now? Why is it making it easy for us to collaborate now? Is it the pandemic, by saying that, oh, because this is such a bad thing happening out there, we better come together? It's kind of, brings the urgency of collaboration together. Or is it that saying, we all know that individually we can't deal with it, it's so big, so we need to collaborate. How do we leverage the new reality to collaborate better? Right. So, that's my question to all of us, because I'm seeing collaboration as a solution and also as a barrier, right? Because, people have to kind of break their minds to kind of come together to collaborate. So any thoughts, any reflections on this? I'm not going to point to any one of you here. Please go popcorn style. What do you think is the way that we can leverage our current reality to collaborate and come together better?
Okay, so one of the things that I have seen, and this is just using the example of Africa CDC together with the African Union. So one of the things that the Africa CDC was able to do was to bring together different countries within the continent and say, guys, we know that we want to purchase, for example, reagents for testing. We know that we want to buy PPE, we want to do this. But if you go it on your own, you have very small numbers. But what if we buy it together? We have this single purchasing platform where we can buy it together and we're able to get bigger orders, that cannot be ignored by the manufacturers. I say that has been a very good example of collaboration, because what we realize, as you said, that if you go it alone, yes, you might go faster, but you may not necessarily, get to have it done better. And, there are better ways of doing it. So I think that has been one of a good example to just show that collaboration together can accelerate how you do things. So it becomes someone else's monkeys to go and negotiate and say, look, I have orders from 41 countries, for example, and all these countries, this is what they need. And nobody says no to such numbers, nobody says no. So I think, as you rightfully may have put it, my view is that collaboration has been able to show us that we cannot do it alone. Nobody even understands this pandemic, so to speak. We are all at the same place. We are all learning from it. So why not learn together? Because if we then do it as silos, we will not be able to do more. The other thing I think that has been a way of collaboration has been the WHO, the COVAX initiative, where you bring all the countries that are developing the vaccine together into this platform to avoid nationalizing whichever vaccine that will have been shown to be effective. I think that also is one way of collaboration. So I think there are pockets of excellence in terms of collaboration. What we now need to see, other than at that national level, is to see organizations such as ourselves collaborating more and supporting each other. So I can be able to get something from NECA in MDoc and be able to collaborate with her and maybe my underwriter in another space, and the many things that we are doing. So that is not at that level. There's a lot that needs to be done. That will be my submission.
Yes, and Vishnu, if I may, I would completely agree with what Diana has highlighted, and around this notion that I think people realize. I mean, to your earlier points, that COVID, affected the whole world, right? We learned from COVID something we already knew, but that the world is wildly connected, right? And so, to your point, you hear this often, that 1% of the pie. Or what is it? What do they say? 1% of like $1, right? Is, I can never get this right. Is better than 100% of nothing, right? So I think people realize, look, this pandemic is huge, and no one is going to solve it alone, right? To Diana's point, and we can capture value, right? We can capture value, but we can probably capture it. We can definitely ensure we capture it by working with others. And working with others may allow us to be more agile and more responsive. And I think if you really look at the pandemic, it's really been about agility and responsiveness. And the great thing is we've been able to learn from other pandemics. We've been able to learn, those of us in Africa have been able to learn from Ebola, and where we failed in the West African outbreak in Ebola, and realized we were not agile, we were not responsive, we were really not person-centered. We actually were quite egotistical and siloed in terms, if we think, just to use kind of what Ilka said about silos. And we knew that we had to have a different approach, and we could still have impact but capture value, right? And so I think people recognize this time working together, yes, we're going to capture 0.0001% of whatever the value is, while delivering impact, at a scale we probably never would have been able to do before by ourselves. So I think that's it. But I will push back and say, even though I've highlighted, yes, people say collaboration has happened, etc. I will also say to you, I actually don't think it's happened in many other instances. as a social entrepreneur, I mean, we've had some phenomenal examples of collaboration. I actually just want to highlight the Making More Health program is one of the first that actually reached out to us as a social enterprise saying, how can we support you? We see that you're trying to make a difference. What can we do to support you as an organization and support you to make an impact? Which was phenomenal when we were having sleepless nights, trying to respond to the needs of the people that we served. Not everybody did that. Not everybody, wanted to go at it together. I mean, I still think that, yes, collaboration has happened, but I will say that I've also seen a lot of challenging things and things that have been somewhat, really not necessarily heartbreaking, but frustrating, where we still have some of those, I think smaller mindsets about what it takes to really make a difference and change the health narrative while, essentially, either generating whatever it is, whether it's profit or whatever it is, or having a seat at the table. There's been a lot of hesitation around collaboration as well. So I think we also have to put that out there too, that it hasn't been all roses across the world, and many people, and that is why we're seeing the inequities, in the numbers, in terms of who's dying, who's suffering, who may not have access to the vaccines when they're available. And so now the question that we have to look inwards and say, okay, what can we leverage? How do we build upon the collaboration that's happened? What are we willing to give up so that we are able to actually make, large scale impact so that everybody benefits and not just the chosen few?
Yeah, and I think from my perspective, collaborations, as mentioned for the pandemic crisis now, I think they are driven by the sense of urgency, and creating solutions, which is important for the global system, Another very interesting, topic for me is where I see somehow the same is antimicrobial resistance. We know for a long time that we need new antibiotics. And it was like the elephant in the living room. And it was not attractive, and it was shelved if you develop something new therapeutic around that. And we see now, also a bigger sense of urgency, and we see more collaborations. We see collaborations, joint ventures, substantial joint ventures between major global pharma partners and also smaller biotech innovators. And the question is, how can we, it's a philosophical question, how would it be possible to leverage this agility, to transfer it or translate it into systems which do not yet have this sense of urgency, and be more preventive by establishing new innovative collaborative models.
Thank you, Ilka. And we have a lot of active participants, and thank you for being with us. And unfortunately, we are not able to see and interact with you live. So we have our, secret listener, Yeleka, now with a lot of questions. So Yeleka, why don't you kick us off with some questions?
Yes, and I'll get right into it. This first question is coming from Francesca, who wants to know, it's open to everyone. Do you think that the PHC providers, such as nurses and community health workers, will be given more importance, given that their role was so key and has finally become evident both in developing economies and high-income economies?
Neka, do you want to take that?
Yes, I'm happy to take that. So yes, I actually think that, from an investor's perspective, I would argue that community health workers and primary health care has been at the top of conversations on the global health scene for, I would say, the last few years. I think the issue has been at the health system level. At the beginning of this, I talked about some of the legacies in healthcare and in our clinical systems, et cetera. And so people get, physicians, I'm a pediatrician, so I'll say this, but physicians get often worried about, the notion of task shifting or other allied healthcare providers. And I think that starts in our education systems. And I think we need to do more. As a physician, I was trained in the same class. My anatomy class I took it with physician assistants or physician associates. And that made us all really value their role and where we all kind of, how we had to work together. So I think if we look at our education systems and revisit how we're training our allied healthcare providers and understanding the role that they play together as part of a larger multidisciplinary care team, if we teach this notion of multidisciplinary care and really highlight the value that each of us has to play, which is different, but collectively will have great impact, we can really make a difference. So I hope, but so it's not really on the investment side. In fact, I will tell you, I believe that we have underinvested in tertiary care in our countries. I mean, you heard everyone was worrying about ventilators, etc. And I'm like, why are you worried about ventilators when we don't even have one ICU physician or ICU nurse who can even run the thing? I'm a pediatrician, I can't run an ICU. So, and there was no conversation about that. But primary care, I think if we just revisit our education systems, really support governments to think about how to look at it holistically and facilitate multidisciplinary care, we'll have a different tomorrow in health.
I'd like to also just add something just briefly on the same. One of the things is that there's been a lot of conversation in order for the world to accelerate on SDG 3. Most countries have to adopt the UHC universal healthcare. And I think the biggest pillar for universal healthcare is the primary healthcare. And at that level, we do for sure, we need to be able to have community healthcare workers, because without them supporting us at the very primary level, everything else that we create up there will just collapse because it's not supported. So just to answer Francisca's question is to say, I think also with the pandemic, it has provided and accorded us the opportunity to go back and relook at that missing piece, which is the primary healthcare at that level, and to be able to know that that place, the community health worker, is the person who supports us at that basic level. Yeah.
Thank you, Diana. Yelika?
Yes, another question coming in directed to pharma companies. So what would be the motivational drivers for pharma companies to invest in prevention and capture the value and return on their investments if we focus on prevention?
So we're going back to the prevention question, Ilka.
Yeah, which is not an easy one, I think. I mean, what is the driver? Yeah, the driver is has to be on one side, it has to be impact, yeah, and it has to be also responsibility, yeah. In the developed world, I think prevention is already a huge topic. Yeah, it is rolled out. I mean, you see a lot of campaigns in major diseases. It's there, people can access it mostly, get education to understand the value. But in underdeserved countries, I think the motivation must be to invest in health, basically, yeah, to invest in healthcare and to take up social responsibility. And of course, with prevention also comes a market, yeah, but maybe not now, yeah, in the future, yeah, and this is a task for building the future.
And if I could just add to that as well, I would say there's a spectrum, right, in terms of what prevention can do. And so if you look at, where we serve, across Africa, people are suffering unnecessarily from chronic diseases with complications. So we don't have the data, unfortunately, to show this, but even just out of 12,000 people, for instance, with diabetes and hypertension on our digital platform, 84% of them have never had an eye exam. 90% have never had a foot exam. So that just tells you right there that they're being set up for severe complications because they haven't had access to primary care, because we don't have a culture of primary or preventive or promotive care. When you go to a clinic, people say, what's wrong with you? You're sick. It's never that it's about wellness. We don't have that concept. It's not a way of thinking. And I will say that, we've had support through the Making More Health program, through BI, in terms of supporting people to provide this preventive and promotive care digitally, so that yes, they may have a chronic disease, but we're preventing complications. We're preventing the catastrophic burden that comes when they have these complications and puts them right into poverty, right? So there's a lot, I think, that pharmaceutical companies can do in terms of really helping provide that whole person-centered care to ensure that truly people are living healthier, happier, and longer lives.
Great. I know we are almost heading towards the end, but let's just take one last question, and the challenge for us is to respond with a 10-second answer. So yeah, like the last question.
Apologies, I don't know if it can be done in 10 seconds, but with the surge of telehealth solutions, how will care move from the hospital to the home and reduce the hospital-acquired infections? And how do you see this happening?
That's a very rich question. So who wants to go for it? But challenge is to make it very short. Nika.
So I can just say it's going to be a hybrid. It's going to and it's going to be a hybrid, unfortunately, still based on your where you are geographically, what your income level is, how willing your government is to invest in telehealth, how willing your education systems are to invest in teaching providers, nurses, pharmacists, etc., community health workers, how to leverage digital, teaching leaders how to manage people with digital. And so until we get there, it's going to be a clear hybrid, with varying degrees of intensity on either side across the world.
Thanks, everyone. If nothing else, I really enjoyed the session because, we really talked about the opportunities, not just getting stuck where we are, but rediscovering opportunities has been the theme. And, I think some of the things which came up and it's going to stay with me for a while is the digital and the data. How do you actually leverage that to do better and, do the right things for the communities and for the future? I think we talked about prevention quite a bit, and we also talked about, how all of us, because we are undergoing this isolation and mental health has become sort of a highlight, which is really, it's the blessing in disguise, I would say. And last but not the least, collaboration remains a challenge. I think it's going to remain a challenge even in the future. But I hope, we can leverage all the environment right now to kind of push people harder to kind of come together and collaborate. I hope we can do that. But last but not the least, in the theme of what we spoke, that it's a clear distinction of before and after. And firstly, let's realize that we are all fortunate to live through this transition. Yes, it is tough. It's going to be tough for at least the next 6 months, 12 months, whatever the time frame is. But this is a fantastic opportunity, if for nothing else, but to collect stories to tell in the future. I think, people will come to us and ask us questions about how did you live through that isolation? What was like when doing things online? Or maybe this is going to become the reality of the future. But let's go ahead and collect as much stories as we can so that in the old age, we can tell our great-grandchildren. Thank you so much for joining us. And this has been a pleasure. And have a great rest of the 2 days for the remaining of the conference. Thank you so much.